Hi, I'm Dr. Whitworth, Medical Director of Pediatric Infectious Diseases here at Cook Children's. After almost a year of working with children with COVID infection, we are so happy that the vaccine is finally out. There are a lot of questions from the community about the safety of these vaccines because they were developed so quickly. There is a cooperation between the United States government and pharmaceutical companies that was formed last spring called Operation Warp Speed. What this means is that vaccines were able to be developed safely in about 10 months instead of their usual time course of about 6 or 7 years. Before, a vaccine would go through trials in a sequential order, phase 1, phase 2, phase 3, and then they would go to the FDA, and then they would be manufactured, and then they would be distributed. Operation Warp Speed allows this all to occur at the same time. And so vaccines were being developed at the same time that there were plans for distribution, at the same time that they were also being manufactured. The government knew that they would pay for vaccines that in the end might not work, and those vaccines would be thrown away without loss to the companies. The vaccines that do work at the time of FDA emergency use authorization are able to be distributed because they've already been manufactured and they're ready for distribution, and those plans were set up. So Operation Warp Speed was a safe way to develop vaccines where everything happened at the same time instead of over a long period of time, over years. Here's how the vaccine works. The two vaccines that are currently on the market are messenger RNA vaccines. We all make messenger RNA in our bodies all of the time. This messenger RNA helps our bodies to make proteins. The vaccine is a strand of messenger RNA in a special lipid package that's injected into the arm. The lipid package helps that messenger RNA get into white blood cells and nearby muscle cells. The messenger RNA is taken up by the cells, and that strand of genetic material tells our bodies to make the spike protein of the virus. When our bodies do that, the white blood cells and your immune system recognize that that spike protein doesn't belong there. It's considered foreign, and we develop an immune response to the spike protein. After that, if we see the coronavirus that has the spike protein again, our bodies react quickly with an immune response, and they prevent us from getting ill. It's important to know that the messenger RNA never goes in the nucleus of the cell. It never becomes part of our genetic material. The messenger RNA is broken down very quickly after our cells use it. As with most vaccines, there can be some side effects, and we know that there are some with this vaccine. The Pfizer vaccine has been approved for use in those ages 16 and older. We do see some side effects that we call reactogenicity, where you have swelling or redness or pain at the injection site, which is not unexpected. Some people will develop some symptoms over the next 24 to 48 hours that would include things like fever and chills, muscle aches, bone pain, and things like that, where they really don't feel very well. In all of the studies, this was over by 72 hours, and this is just part of your body's reaction to the vaccine so that it will recognize COVID-19 disease in the future and prevent you from getting it. The Pfizer vaccine was 95% effective in preventing COVID disease for those who got the vaccine. While we don't know of any long-term side effects from this vaccine, we don't expect any based on the history of other vaccines. But we can't say that the chances of that are zero. We just don't know for sure. Cook Children's believes in the ability of the vaccine to prevent COVID-19 disease for those who are 16 years of age and over. I personally got vaccinated, and I feel relieved. I did this for my family and for my friends and for my co-workers, and I'm glad to have that done. Even while we're in this time where we're getting vaccinated, we need to remember to wear our masks and to practice social distancing as often as we can and to avoid large gatherings. We can all get through this together. There is light at the end of this tunnel.